Acute Care Nurse Assistant, Module 4, Care of the Surgical Patient. Statement of purpose. The purpose of this module is to prepare the nurse assistant to care for the perioperative patient in the preoperative and postoperative phases and in preparation for procedures. Terminology. Performance standards or objectives. Upon completion of 5 hours of class plus assignments and 8 hours of clinical experience, the learner will be able to define basic terminology, recognize and report patients' concerns regarding surgery, list care measures provided for the pre-operative patient, explain the nurse assistant's responsibility while the patient is in surgery, describe patient care measures provided in the post-operative phase, explain the safe management of the patient with various tubes. Identify various types of binders and state their purpose. Explain the nurse assistant's role in providing comfort measures. Give examples of hot and cold therapies. Content Outline Theory Sections. Section 1, Basic Terminology. A. Terminology. B. Clinical Application. Section 2, The Patient's Concerns Regarding Surgery. A. Concerns. 1. Pain, considered the fifth vital sign. 2. Length of recovery. 3. Loss of control. 4. Complications, such as mutilation or infections. 5. Fear of death. 6. Personal situations, like home, children, pets, or bills. B. Care measures. Listen attentively to any of patient's concerns. Provide support, general information within the nurse assistant's knowledge. Report any serious concerns to the licensed nurse. Section 3. Care measures provided for the pre-operative patient. A. Reinforce patient teaching. 1. Incentive spirometer. 2. Leg exercises. 3. Turn, cough, and deep breathe. 4. Early ambulation. And 5. Range of motion. B. Psychological preparation. Relay any questions the patient has about doctor's orders to the licensed nurse. Observe for signs of fear through body language and statements. Listen to how patients phrase questions to help determine concerns. Reassure patient as appropriate. C. Perform tasks from the pre-operative checklist. 1. Shower and bathing. 2. Enemas, per hospital policy. 3. Non-sterile douche, per hospital policy. 4. Shave, prep. 5. Hospital gown. 6. NPO after midnight as ordered by physician. 7. Vital signs. 8. Remove dentures if ordered. 9. Remove prostheses, such as hearing aids, glasses, contact lenses, splints, braces, artificial parts. 10. Remove jewelry, hairpins, and makeup. 11. Tape wedding rings, if allowed. 12. Assure security of any items of value. Give jewelry to a family member with patient's permission. 13. Have patient empty bladder. Drain Foley if present. Record output. 14. Notify medication nurse when patient is ready. And 15. Provide for a safe environment after preoperative medication, i.e. the side rails are up, safety belt fastened on gurney, call light in reach. D. Identify nurse assistant's role in pre-operational checklist. E. Document on the pre-operative checklist. Section 4. The nurse assistant's responsibility while the patient is in surgery. A. Prepare the room. 1. Surgical bed. 2. Emesis basin. 3. Facial tissue. 4. Vital sign equipment. 5. IV pole. 6. Incontinent pads. B. Collect additional equipment as ordered. 1. Oxygen equipment. 2. Pulse oximeter. 3. Suction. Section 5. Patient care measures provided in the post-operative phase. A. Post-operative checks. Note time of return. Note level of consciousness. Check dressings for location and condition, such as dryness. Observe incisions, report any drainage, redness, or swelling. Assessing and changing the dressing is the responsibility of the licensed nurse. Check IV for location and observe site for redness, swelling, warmth, or drainage. Observe to see that the IV is dripping and tubing not kinked. B. Post-operative care measures. Assist in transfer from gurney to bed. Vital signs. Be aware of changes in vital signs that signal hemorrhage, such as decreasing blood pressure and increasing pulse. Elevated temperature may signal infection. Report abnormalities to licensed personnel promptly. Use pulse oximetry. Observations. Comfort, such as the degree of pain or other discomfort. Safety, such as side rails, call light within reach. Equipment. Report if disconnected or malfunctioning. Changes in behavior, such as confusion, disorientation, and agitation. Changes in skin color, such as pallor, gray, or blue-tinged. Nausea and vomiting. Bowel activity, passing gas. C. Care measures to prevent complications. 1. Encourage, such as turn, cough, and deep breathing, incentive spirometer, and leg exercises. 2. Apply TED hose and sequential compression devices if ordered. 3. Reposition at least every 2 hours to prevent hypostatic pneumonia. 4. Apply binders if ordered. 5. Assist with dangling and initial ambulation as ordered. 6. Review hazards of immobility and role of the nurse assistant. D. Complications of immobility. Deep vein thrombosis, DVT. A blood clot in the lower extremity. General information. Deep vein thrombus, DVT, or blood clot occurs in pelvic veins or deep veins of the lower extremities in post-operative patients. The incidence of DVT varies between 10 and 40%, depending on how serious the surgery is and how many other medical problems the patient has. DVT is the most common following hip surgery, then prostate surgery, and general thoracic or abdominal surgery. Blood clots located above the knee are considered the major source of pulmonary emboli, a blood clot that dislodges from the vein wall and travels to the lungs, causing death of lung tissue. Causes: pooling of blood in lower extremities, venous stasis, inactivity and immobility. Some medical conditions, such as a stroke, heart attack, congestive heart failure, obesity, varicose veins, surgery and anesthesia, age, particularly over 65 years, damage to or stretching of blood vessels during surgery or trauma, central venous catheters, pacemaker wires, previous DVT, increased tendency of blood to clot, some diseases like cancer, blood diseases, protein deficiency and malnourishment and dehydration, oral contraceptives and estrogen replacement, and smoking. Symptoms of DVT often have no symptoms. Pain or cramp in calf or leg, progressing to painful swelling of entire leg. Slight fever, chills, perspiration, diaphoresis, generalized feeling of discomfort, painful tenderness over inner thigh. Prevention: increased activity, early ambulation after surgery, frequent and proper repositioning. Range of motion: anti-embolic stockings, or TED hose. Purpose of anti-embolic stockings: to help prevent formation of blood clots, to promote increased blood flow in the legs by compression of deep veins, to improve venous return from the legs to the heart. Maintenance of anti-embolic stockings: properly sized stockings need to be removed daily during bathing to inspect condition of skin. Do not leave off for more than 30 minutes. Wash stockings every 2 to 3 days to remove bodily secretions. For patients' information at home, the stockings can usually be machine washed on delicate and machine dried on low for 15 to 20 minutes. With correct care, stockings can last 3 to 4 months. Do not use ointments on the leg when using anti-embolic stockings. Sequential compression sleeves or devices. Adequate fluids. Avoid dependent positioning of lower extremities. Elevate leg when up in chair. Avoid knee gash when in bed. Doctor may order anticoagulants for licensed nurse to administer. Observe for signs of bleeding or bruising. Observe for pain in calf. Fever or chills, painful swelling of leg, tenderness over inner thigh. Report any shortness of breath or chest pain immediately to the licensed nurse. E. Nursing alert. A complaint of slight soreness of the calf is never ignored. Blood clots in the calf or thigh can break loose and travel to the lungs, causing a pulmonary embolism. This is life-threatening. Close observation of patients and attention to their complaints of pain or discomfort is very important. Report this to the licensed nurse. Never rub or massage the lower legs. Section 6. The safe management of the patient with various tubes. A. Safety precautions. Know purpose and location of all tubes. Check drainage for character, color, and amount. Keep tubing free of kinks. Never disconnect tubing. Never raise drainage collection bag above the level of the insertion site. Never lower the IV bag below the level of the insertion site. Never pull tubes when moving patient. Never assume the responsibility for chest tube drainage or attempt to empty. B. Report the following changes: any signs of leakage or disconnection, pain, discoloration, or swelling at the sites of the drainage or infusions. Change in the amount of color and character of drainage. C. Intravenous therapy. Purpose of IV fluid replacement: replace fluids and electrolytes, prevent dehydration, administer IV medications, and nutritional support, TPN, PPN. Signs of infiltration or infection, such as changes in skin temperature at IV site, pain, burning, leaking, swelling, and redness. Report any IV pump alarms. Report disconnected IV tubing. Report blood backup to a licensed nurse. Bathing precautions. Flow rate. Alert nurse when IV bag is low in volume. Check that the IV bag is dripping. Never adjust roller clamps or flow rate. Blood products. Sign of blood reactions: shaking, chills, elevated temperature, flank pain, rash or hives. D. Wound drains. Use standard precautions when emptying drains. Maintain drain compression. Keep accurate record of output from wound drains, even small amounts. E. Nasogastric tube. Observe for signs of distress, such as coughing, gagging, shortness of breath, nausea, vomiting, and report these to a licensed nurse. Maintain patient drainage system and observe for signs of choking. F. Catheters. The types: urinary, suprapubic, condom cath. Safe management: proper taping, assure drainage, observe color, clear or cloudy, and report pain. G. Oxygen tubing. Connections: assure that the cannula or mask is on the patient. Check patient comfort related to pressure, such as sores or irritation. Section 7. Various types of binders and their purpose. A. Purpose: to hold surgical dressings in place, to provide support, and to prevent wound dehiscence. B. Types: abdominal scultitis, breast, T-binders, single and double. Montgomery straps. Section 8. The nurse assistant's role in providing comfort measures. A. Pain management. Splint incision. Back rub. Promptly report complaints of pain and lack of response to pain medication. Reposition for comfort. Equipment safety. Patient-controlled analgesia. Only patient should push the button. Epidural catheter. Prevent catheter removal with turning and movement. B. Oral hygiene. C. Environmental temperature control through blankets and thermostat. And D. Review pain scale. Section 9. Examples of hot and cold therapies. A. Treat for injuries and wounds to help relieve incisional pain, cellulitis, pressure sores, sprains or strains, arthritis pain and inflammation. Heat and cold application have opposite effects. Heat dilates, cold constricts. C. Severe injuries can occur with both therapies. Observe precautions with each therapy. Some states or facilities do not allow nurse assistants to apply hot or cold therapies. Check with a licensed nurse and facility policy. D. Heat therapy. Prevent hypothermia after surgery. To speed healing. To control pain. E. Cold therapy. Reduce swelling, control bleeding, and control pain. F. Equipment. K-pad. Warming and cooling blankets. Ice packs. Soaks and compresses. And sitz bath. G. Hypothermia care. Examples. Cold constricts blood vessels and helps prevent swelling and reduces inflammation. Cold applied immediately after a strain or sprain or contusion helps reduce swelling and bleeding. Cold applications can help relieve pain, stiffness, and muscle spasms. Ice collars, ice bags, disposable instant cold packs, gel-filled cold packs, and hypothermia blanket. H. Nurse assistant's role with cold therapy. Complications can occur from cold therapy. Know the role limitations of the nurse assistants in each facility and proper procedure before applying cold therapy. Use with caution in patients with circulatory problems. Check with licensed nurse for specific instructions for each patient. Know the precise location the compress is to be applied. Always cover cold applications with soft cloth or flannel cover that comes with the device. Never place cold compress directly on bare skin. Check skin frequently every 5 minutes under cold applications. Report any of the following complaints to the licensed nurse immediately. Complaints of numbness, pain, or burning, blisters or burns, pale white or gray skin, cyanosis, and shivering. Leave application on only as long as directed by the licensed nurse, but never longer than 30 minutes. I. Hyperthermia care. Heat dilates blood vessels and increases blood flow to help speed healing. Heat applications help relieve pain, relax muscles, reduce swelling, and decrease joint stiffness. J. Examples. Hot compresses and hot packs, aquathermia pad, and disposable hot pack. K. Nurse assistant's role with heat therapy. Complications can occur from heat therapy. Know role limitations of nurse assistant in each facility and the proper procedure before applying heat therapy. Know how to operate equipment used in the procedure. Make sure temperature of water or pad is accurate as ordered. Check with a licensed nurse for specific instructions for each patient. Know the precise location the heat therapy is to be applied. Patients who have circulatory problems or difficulty feeling heat or pain should have heat therapy performed by a licensed nurse. Heat is never applied to an area that has a metal implant, such as a pacemaker, knee, or hip replacement. Always cover dry heat applications with a soft cloth or flannel cover that comes with a device. Check skin frequently, every 5 to 10 minutes under hot applications. L. Report any of the following complaints to the licensed nurse immediately. Complaints of numbness, pain, or burning, excessive redness, blisters or burns, pale white or gray skin, cyanosis, and shivering. M. Leave application on only as long as directed by licensed nurse, but never longer than 30 minutes. N. Follow rules of electrical safety when using electrical appliances to apply heat. Sample preoperative checklist. Examine the surgical checklist. List the items that are a nursing assistant's responsibilities. Sequential compression devices. Several types of devices are available that supply intermittent compression over the lower leg, thigh, or foot. Each device aids in the return of venous blood and helps prevent deep vein thrombosis and pulmonary embolism. They are usually used in addition to anti-embolic stockings. The typical type of sequential compression device consists of a vinyl or plastic sleeve that fits over the foot, lower leg, or thigh. It may come as a tube or as a wrap style that fastens with Velcro. It is attached to a control unit that is placed on the floor under the bed. The control unit has a small pump that inflates and deflates channels in the sleeve to provide increasing and decreasing pressure. Connecting tubing attaches to the sleeve and to the control unit, completing a closed system. The pressure can be adjusted according to facility policy or as ordered by the physician. The device should be removed at least twice daily for 20 to 30 minutes to allow for ambulation, bathing, and inspection of the skin. Sequential compression devices are usually worn at least 3 days after surgery, or until the patient is up and ambulating regularly, or as long as the doctor orders. Equipment. Sequential compression sleeves, connectors, control unit. Criteria. Safely cares for the patient on a sequential compression device. 1. Wash hands, identify patient, introduce self, explain procedure, and provide for privacy. 2. Position the patient, exposing one leg at a time for application of sequential sleeve. 3. Align leg on the open sleeve according to the instructions included in the package. 4. Wrap the sleeve securely around the patient's leg and fasten the Velcro tabs. Thigh section first. Make sure no wrinkles are in the plastic of the sleeve and that at least 2 fingers can be inserted between the patient's leg and the sleeve. 5. Make sure the control unit is turned off. 6. Attach the connector on the sleeve to the correct end of the connector tubing. Check carefully to be certain there are no kinks or twists in the tubing. 7. Attach the other end of the connector tubing to the control unit. 8. Turn the power on and adjust or monitor the pressure according to your facility's policy. 9. Remain with the patient for at least a complete cycle to monitor comfort and the functioning of the unit. 10. Sleeves should be removed if the patient experiences numbness, tingling, or leg pain. Notify the licensed nurse if any of these symptoms occur. 11. Document time of application, type of device, condition of skin, and comfort of patient. Precautions. 1. Do not apply to any patient experiencing skin rash or poor circulation, evidenced by bluish-red coloring of lower legs and feet, sores on the lower legs or feet, severe edema or leg pain, or edema of the lungs from congestive heart failure. 2. Make sure that connectors and sleeves are properly applied. 3. Monitor the patient's condition frequently, according to facility policy. Single leg application. Most brands of sequential compression devices can be used on only one leg if necessary. The unused sleeve is kept in the plastic wrapper and attached to the second sleeve connector. The compression action of the pump will not work unless there is a closed system. By keeping the unused sleeve folded in the wrapper, the system will be able to reach the proper compression. Measuring and application of anti-embolic stockings. Equipment: 1. Tape measure, new one for each patient. 2. Scratch pad, order form or requisition form from Central Supply. 3. Anti-embolic stockings, TED stockings or other brands. Criteria: correctly measures and applies anti-embolic stockings. A. Thigh length. Measure upper thigh circumference at gluteal furrow. Measure calf circumference at widest area. Measure length from gluteal furrow to base of heel. Consult sizing chart from Central Supply or TED stockings order pad if available. TED thigh length and belt stocking fit a thigh circumference of up to 32 inches. TED thigh length stocking fits a maximum thigh circumference of 25 inches. B. Knee length. 1. Measure the calf circumference at the widest area, and 2. Measure length from bend of knee to base of heel. C. Medicare usually covers 2 pair to ensure that compression goes uninterrupted during laundering care. Check with the RN to see if 1 or 2 pair should be ordered. D. Different brands of anti-embolic elastic stockings are available. Each pair will have a large round hole in the toe to check for circulation. In some brands, the hole will be on top of the toes, and some will have the hole under the toes. Application of anti-embolic stockings. 1. Obtain correct size of anti-embolic stockings. 2. Wash hands, identify patient, introduce self, explain procedure, and provide for privacy. 3. When patient is lying down, expose one leg at a time for application of stocking. 4. Insert hand into stocking as far as the heel pocket. 5. Grasp center of heel pocket and turn stocking inside out to heel area. 6. Position stocking over foot and heel. Be sure patient's heel is centered in heel pocket. 7. Pull a few inches of the stocking up around the ankle and calf. 8. Continue pulling the stocking up the leg. If there is a change in the sheerness of the stocking material, it should fall between 1 to 2 inches below the bend of the knee. 9. As thigh portion of the stocking is applied, start rotating stocking inward, so gusset is centered over femoral artery. Gusset is placed slightly towards the inside of the leg. When using thigh-length stockings, the top band rests in the gluteal furrow. 10. Smooth out wrinkles. 11. Align inspection toe to fall at base of toes, either on top or underneath, depending on the brand. 12. Instruct patient on proper positioning of stockings to ensure that he or she will not reposition the stockings incorrectly. 13. Repeat procedure on the opposite leg. 14. Wash hands. 15. Report procedure and document size and style of stocking applied. 16. Document when stockings are removed along with the condition of the skin. And 17. Report any tenderness in calves, thighs, or toes. Turning a surgical patient. Equipment, pillows, and lift sheet. Turning a surgical patient. Obtain patient activity orders from licensed nurse. Instruct patient in splinting incision for comfort. Make sure that the bed wheels are locked. Curtains are pulled around bed for privacy, and bed is raised to highest level for good body mechanics. Lower head of bed if patient's condition allows. Use good body mechanics. Turn patient. Position patient for comfort and in good body alignment. Place pillow under the head. Position a pillow against back for support. Place a pillow in front of the bottom leg and place the top leg on top of the pillow in a flexed position. Check lower shoulder to make sure it is not squeezed in an abnormal position. Reach under shoulder and pull forward gently until patient is comfortable. Support upper arm and hand with a pillow for comfort, either in front of the patient or back on the pillow behind the patient. If abdominal incision is pulling, may place pillow under side of abdomen. Place the signal cord within reach, raise side rails, lower bed to lowest position, and open curtains around bed. Dangle and ambulate a surgical patient. Criteria: safely dangles and ambulates a surgical patient. Check patient's pulse, blood pressure, and respirations. Assist patient to side of bed and put on non-slip slippers. Assist patient to pivot and sit at the side of bed. Support patient and observe for abnormal signs. Assist patient to put on robe. Apply gait belt if allowed. Assist the patient to stand. Stand at patient's side until steady, holding the gait belt in the middle of the patient's back. Stand slightly behind patient, on weak side if applicable. Encourage patient to walk with head up, standing erect. Observe for signs of activity intolerance, such as increased pain, shortness of breath, pallor, or diaphoresis. Return patient to bed and make sure patient is safe and comfortable. Report the distance patient walked and how well patient tolerated activity to licensed nurse. If the patient has an IV, may need 2 people to assist with ambulation. Hazards of immobility and role of the nurse assistant. 1. Cardiovascular complications, such as blood clots, orthostatic hypotension, increased work on the heart. Remind patient to do exercises given by the physical and occupational therapist. Encourage intake of adequate fluids to prevent dehydration. Early ambulation as allowed. Proper positioning and avoidance of pressure on blood vessels. Do not massage the calf of the leg. 2. Respiratory complications, such as slow and shallow respirations, pooling of respiratory secretions, hypostatic pneumonia, and pulmonary embolism. Remind patient to turn, cough, take deep breaths, and to use incentive spirometer. Increase activity as soon as allowed by patient's condition and doctor's orders. Encourage fluids as allowed to keep lung secretions thinned. 3. Gastrointestinal complications, such as poor appetite, poor nutrition, constipation, and fecal impaction. Offer adequate fluids. Prevent incontinence by timely offering of the bedpan and early mobility for access to the bathroom. Monitor patient's appetite and ask the RN to assess need for a dietitian consult. 4. Urinary system complications, such as urinary retention, incontinence, increased risk of kidney stones, and urinary tract infections. Keep accurate record of intake and output. Observe for pain in the back and blood in urine. Observe for signs of urinary tract infection. Pain with urination, frequent urination of small amounts, feeling the need to urinate all the time, and concentrated or cloudy urine. 5. Musculoskeletal system complications such as muscle wasting and atrophy, stiff joints, decreased balance, loss of endurance, osteoporosis, contractures, and foot drop. Perform passive range of motion exercises for patients who are unable to do them, and instruct patients who are able to do active and active assistive range of motion. Position patients properly in bed. Use good body alignment. Remind and reinforce any exercises given to patient by physical or occupational therapists and RN. 6. Integumentary system complications, such as pressure on bony prominences, impaired circulation to skin layers, skin breakdown, pressure ulcers, and infections. Observe for any sign of redness or sores on the skin. Keep skin clean and dry. Keep bedding free of wrinkles and crumbs. Turn patient every 2 hours to reduce pressure on bony prominence.